is Nick Verheyen, and I will be presenting on the harmful effects on the human body due to the misuse of anabolic androgenic steroids. So some talking points I want to highlight. I'm going to introduce the background information regarding the intended subject, which is RAAS, the articles that I will introduce and their findings and why they are relevant, including their conclusion and my personal critique of each one. I will also include some suggestions for further research and intervention programs that may help the misuse of anabolic androgenic steroids, and I want to also highlight why this is important throughout this entire presentation. So some keywords to familiarize yourself with include anabolic androgenic steroids, short AAS. They are synthetic derivatives of testosterone, a natural occurring male sex hormone, and are used to enhance athletic performance and physical appearance. So a common cultural word that we all know of is doping, but that is also just the most common word for the use of steroids. And the adverse effects include so many undesired effects arising from the drug or the action from injecting in the site of the body, and there are short-term and long-term effects. So, why do people use AAS? So, it can promote increased muscle mass, enhance strength, endurance, physical appearance, and athletic performance. Some populations that happen to be at risk include athletes across all ranges of ages, so youth, adolescent, college, and professional level. It does not limit to just athletes. It's also anyone that desires just a better physical appearance. So why is this subject important? The pressure of performance increases as the level of competition rises, so from youth athletes to professional athletes, and athletes in general are most at risk. They are known to strive for excellence, and competition pressures may lead to questionable choices in the use of anabolic androgenic steroids. It is important to understand that it's a psychological drive in order to implement interventions and to become aware of the adverse effects to educate people on the dangers of AAS. So, looking at the steroids and other appearance and performance-enhancing drugs from the National Institute of Drug Abuse, we will be highlighting the adverse effects, withdrawal symptoms, and treatments that it has recorded. So, some adverse effects that are included are cardiovascular system, your hormonal system, infection, liver, musculoskeletal system, psychiatric effects, and your skin as well. So, cardiovascular system, what are the effects? It can include high blood pressure, blood clots, heart attacks, stroke, and artery damage. So by using AAS when into the body, it can rise the level of low-density lipoproteins, and it can reduce the level of high-density lipoproteins. And when it comes to LDLs and HDLs, we want to have LDLs low and high HDLs. The steroids can contribute partly to the development of cardiovascular disease as well, due to the adverse effects. And effects may include heart attack or stroke due to the blood being blocked and not being able to reach the heart or the brain. And the steroids also increase the risk of blood clots that develop in blood vessels, and it can block the flow of blood and just weakening the heart muscle in general. What else? There's also hormonal system that is affected. So there are two differences between men and women. The way that it affects men, it can decrease sperm production, enlarge breasts, shrinking of the testicles, male pattern baldness, and testicular cancer. Whereas in women, it can deepen the voice, it can decrease breast size, it can cause skin to become coarse, it can also cause excessive body hair growth, and then male pattern baldness as well. So next we've got infection, causing either HIV, AIDS, hepatitis. These are all effects that can happen due to using the steroids as an injection. So non-steroidal injection methods can be used by so many individuals that use steroids, and often maybe exchange infected needles with other people, causing a high risk for HIV, AIDS, and hepatitis. Any other effects are also on the liver. So liver injury or tumors are a rare disorder called pilosis hepatis. So This means that the blood-filled cysts develop in the liver, and this has been associated with steroid misuse. We've also got effects on the musculoskeletal system, including a short stature and tendon injury. So here we've got adolescents taking anabolic steroids and artificially high levels of sex hormones, so like the type of drug, can signal the bones to stop developing prematurely, so causing a shortness in stature or tendon injury in general because of the premature development. So not only are there physical effects, but there are also psychiatric ones, so psychological ones, which include, it can lead to irritable and aggressive behavior, and psychological disorders such as mania, depression, and anxiety. And about 32% of people who misuse become dependent on the drug. So another physical effect that we have here is skin. So it can cause severe acne and cysts, oily scalp and skin, abscess at injection site, and jaundice. It can also cause the pain at injection site wherever you injected the steroid. So withdrawal symptoms include fatigue, restlessness, loss of appetite, insomnia, reduced sex drive, and steroid cravings, and depression. So when we look at this, AAS can cause an immense amount of symptoms which are not wanted, but many people do not realize what the long-term or short-term effects may be. They are only focused on the competition and becoming the best of their ability for that specific game. So treatment. Here we can include types of treatments for misuse of AAS. So there's psychological therapies, endocrine therapies, antidepressants one can take, pharmacological and psychosocial treatments for patients who are also dependent on opioids have been proven to also help those that are addicted to AAS. Something to really highlight about AAS use, it is not an addiction such as alcohol or drugs, but is more a psychological addiction needing to enhance performance or just physical appearance, rather than depending on it for their body to survive. So here I'd like to introduce my first article, The Abuse of Anabolic, Androgenic Steroids and Related Substances in Sport and Exercise. So here we see that it's more prevalent in males rather than females. Males, it's 4 to 6%, whereas females have a lesser range of 1 to 2%. How is it taken? It can be injected intramuscularly, or it can also be taken orally. Most recently, due to more and more drug tests within the athletic community, professional athletes have been known to use gels or creams so it can deceive drug tests. And a big thing to also note is that the means of using AAS are different for each type of sport. So bodybuilders that use it want less fat and more lean mass. Weightlifters desire to lift the highest possible amount of weight. Field athletes want to be able to throw the furthest. Swimmers and runners want to be able to perform regularly, high intensity, long lasting. And football players, they want lean mass and just high strength. And in other cases, just in general, if it's not athletic activity, or so if it's just someone in the gym, many just want to appear more muscular and just better physical appearance. This is important to understand why some people have drives to use AAS and the differences between what it can help for which sport. Here we've got another article, Anabolic Steroids in College Athletics, College Athletes and Steroid Abuse. So, why use androgenic anabolic steroids is the question. And this leads to who has done it and what media has covered and what people believe what steroids can do for you. So some famous athletes such as Arnold Schwarzenegger and Lance Armstrong are professional athletes who have been recorded to have used steroids. And roughly 4 in 10 teenagers using steroids have admitted to being heavily influenced by famous athletes doing it. Something that is not too current of event, but what happened recently of 2018, the Winter Olympics. Russia was banned from participating due to the doping conspiracy scandal. So in general, it is a big no-no in the athletic world to be using AAS, but many still do because they believe that they need it in hopes of performing at the highest level that they can. Something I wanted to highlight, especially with college athletes, the pressures of balancing both schoolwork and sports are already so much that the pressures of possibly family, friends, teammates, coaches, say if it's high school scouts, but in general college, everyone, if not maybe, some are really wanting to go pro, and they're trying to impress people, press their stats, get as best as they can be, and the use of steroid or performing-enhancing drugs may pop into their mind, which is a drive for why they use them, because of the pressures and stress. And oftentimes athletes that do abuse the AAS steroids don't think about the ramifications or the implications that it can have on your body and how harmful the effects can be short-term and long-term. They think game first, health comes second. As long as they do well in that one game, one moment, that's all that matters. Not about what may happen in a couple years or what may happen to my liver or my muscles or my skin. It's all based off of just what can I do here and now. So my next article is the psychiatric and medical effects of anabolic androgenic steroid use in women. I think this was really important to include because most of the study and research and the prevalence of AAS are based around males, and it is good to include some female statistics just to be able to compare and contrast. So here we've got participants. It's 75 women. They were all athletes that performed both psychiatric and medical evaluations. They were each recruited from gyms from Boston, Massachusetts area. So out of these subjects, 25 of the women admitted to current or past use of AAS, and 14 of the users reported experiences of hypomanic symptoms, and about 10 reported depressive episodes, and 19 reported at least one adverse effect associated with AAS, so any of the physical effects. So here this just highlights more how women as well use it, not only men. And they exhibited both physical and psychiatric syndromes that are associated with the use of AAS, and just proving how the adverse effects are just so harmful on the body, the human body in general, and just explaining more the dangers of it. So here we have another article that I want to introduce. It's a national study of substance use behaviors among NCAA males athletes who use banned performance-enhancing substances. So I thought this was really important because we are in college and it just reaches to the audience, and there's many athletes on campus, especially in the exercise science major. So the National Collegiate Athletic Association, they decided to collect data from a large national data set. The aim of this study was to compare the behaviors of male undergraduate student athletes who reported using ergogenic performance-enhancing substances during college years with those who did not. So the results indicated that male college athletes who used performing-enhancing drugs during college had shown a general tendency to participate in also alcohol and substance use activities. So regardless if it helped enhance performance or anything in that manner, they found a trend that if you did use AAS, you also had a higher risk of using any other type of substance or drug. So this raises a question. So since there is this general trend that's not always correlated to enhancing athletic performance, what may also contribute to influence the use? Is it the culture of the college? Is it peer pressure? Is it a stress reliever? Is it just in general the stress of the game? So that is what everyone has been researching and trying to answer. So here I've got a study, the NCAA study of substance use and abuse habits of college student athletes. So here we've got the methods, and the reports were collected from NCAA Division 1, 2, and 3 institutions. A total of 13,914 students participated, and they were males and females collected from 30 different competing sports at 991 NCAA institutions. So the categories tested and asked more so were alcohol, marijuana, tobacco, steroid use, and it was proven that the physician stats for steroid use was more exact of a test than the actual study. So here it showed, some of the results showed that the Division I college had the lowest use. Highest in Division II included alcohol, cocaine, amphetamines, marijuana, and psychedelics. And interesting enough, based on demographics, highest in Caucasian students, smokeless tobacco, alcohol, ephedrine, amphetamines, marijuana, and psychedelics. The results yielded that a trend that drug abuse is more common among Division III athletes and Caucasian athletes. The highest drug use in general is alcohol, which is not surprising, meaning the culture of college and what people think of it, and also because it is the most available drug, especially most people also turn 21 during college, so it's just that much more available than any type of drug. I thought that this would be an interesting and relevant study because Belmont is a Division I college, and it is interesting to compare and contrast the different divisions of institutions and their use of just the collected data on use of any type of drug, and just understanding the differences. So here we have another study, the effectiveness of anabolic steroid preventative interventions among gym users, and applying the theory of planned behavior. So this is a study based on implementing a behavior program and trying to reduce the misuse of AAS. So the study included 120 male gym users, and the type of study was a longitudinal study, so they were first asked questions, implemented the behavior, and then re-asked questions after. So the implementation of a behavior modification program with the intention to prevent androgenic anabolic steroid use. So 30 bodybuilders were included in the study, and given questions related to the behavior modification program about length, time of completion, and internal reliability of steps. So here they linked the abuse of alcohol, morphine, and other addictive substances. The purpose of this specific study was to test the efficacy of a prevention program for AAS misuse, and it focused around those that went to the gym. And the intervention, averagely the responses, like the participants and the behavioral intention, it increased significantly. So, I mean, the predictability of the subjective norms and perceived behavioral regulation of the intent to use in different cultures and population appear to be essential. The study, though, had no definitive conclusion about why it was reduced, because there needs to be more research in general on intention and social pressures for wanting to. And also something about this is it can be done again, and being able to collect more data after. So say that they implemented these behaviors, but then maybe 60 days later they go back because they're no longer implementing. So I believe the study should be longer and just redone. So future research in general include just more research must be done in regards to the psychological pressures in the use of anabolic androgenic steroids. So researching more into the pressures of just social aspects such as family, friends, teammates again, Coaches, it's always a big pressure wanting to be the best, holding your weight on the team and not letting your coach down or your team down. And sometimes people want to perform to the best of their ability and then turn to AAS, which is really unfortunate because of the ramifications of the harmful effects later on in life. More research does need to be done to compare men and women drives. Obviously, it's more prevalent among men than women, and I think there should be research done understanding why, and also comparing the differences of the why. And then, in general, as I said before, researching more cultural, social, and behavioral drives, because this is considered more of a psychological addiction. So it has to be, the drives are a huge factor of why there's a misuse of AAS. So some takeaway points from this study, just in general in this presentation. So anabolic androgenic steroid use is not limited to only athletes, but anyone who wants to enhance their strength or physical appearance. It is just that athletes are at higher risk and there is more use within the athletic community. The use of AAS have both short-term and long-term effects on the body. Something again to note that I've highlighted a lot is that this type of addiction is not the same as alcohol or drug use. It is more of a psychological addiction. The importance is, it is huge to raise awareness about the implications of AAS use because the population it affects is not restricted to athletes, but everyone. And I believe that is important because we want to keep our bodies healthy, active, and just reduce any effects that could happen due to AAS, and just implement more education on this to avoid the use of anabolic androgenic steroids. Thank you.